Hello, everybody. Let's discuss frequent urination or having to run to the bathroom a lot or constantly feeling like you're peeing all the time. There's many different things that are going to cause someone to urinate a lot, but I kind of want to touch on specifically when you start a health journey. Why do you run to the bathroom so much? It's not just because you're drinking more water. It's really not. So there's many things that can cause frequent urination. There can be problems with your urinary tract or your kidneys or the tubes that connect them. There might be an infection or a disease, touch wood not, or there could be injury. There could be muscle issues going on there. Then there's obviously other anatomical things that can happen, like prolapsed anterior vaginal. We've got diabetes can cause people to urinate more. So diabetes type 1, 2, and insipidus. Diuretics, of course, can cause you to urinate more. Anything with caffeine and alcohol. Vaginitis, infections, antibiotics. Urinary incontinence, urinary tract infection. Like, there's a lot of things that can cause someone to urinate a lot. But when it comes to like, oh, I just started a health journey or I'm doing a detox or a cleanse, a lot of people think, well, it's just because I'm drinking more water. And I really want to help people to understand. So when you start a new health journey, diet, detox, whatever it is, depending on what it is, this may or may not happen. It really depends on the protocol you're following. But let's say it's lower carbs. So my new 21-day detox, for example, is lower on the carb side for the first week. So carbohydrates cause the kidneys to retain fluids. They do. That insulin response causes the kidneys to retain fluids and manage the minerals and sodium, potassium pump and balance in your body. When you reduce your carbohydrates or your sugar, then you take out that aspect of fluid balance, especially in the kidneys. So when people do go like low carb or keto, they will peel off, but they also, because they're urinating a lot more, they're going to be losing a lot more minerals. And that's where people start to have like the keto flu, or they get blood sugar or blood pressure drops. And usually the recommendation is to just bring in some sort of electrolytes, is usually pretty handy. Some people might need some sort of sugar or glucose aid to stimulate the kidneys. But that's why it happens. Carbohydrates or sugar, they stimulate your kidneys to hold on to fluid and to balance the fluid in your body properly. Fluid being the water channels. And the minerals. Electrolytes are minerals with an electric charge, which helps them get into the cell better. Anyway, so that's one of the main reasons that happens. So carbohydrates are also water hydrophobic, so they attract water to them. So when you have carbs, so think of bodybuilders when they're in like super compensation mode, they look like really lean and very defined. And then if they have a carb refeed or a reload, they look swole, they'll look puffy, because they've just reloaded the muscle glycogen, and that with that has brought the water. So when I speak to my clients, I'm thinking, okay, think of a carbohydrate like a sponge. It's dry and then it sucks in all the water and it puffs up, but also carbohydrates cause you to be thirstier because they've sucked in a lot of water. So then you get puffy or you get swole, and then you also are going to need more water because of the dehydration aspect of it. So then when you kind of go low carb or you eliminate the carbs, then you've got the kidney aspect, but you're also not holding on to water because you don't have this carbon backbone, the carbohydrate. You don't have the carbohydrates holding on to fluids. So you got the kidneys, and now you're flushing a lot of water as well. Then, depending again on your protocol and what you're doing, if you are pushing your body into more of a fat burning state. Like if you're optimizing fat burning as your metabolic fuel, when you break fat, you generally, apart from the toxins and the hormones and all that, but the two main byproducts you get when you break down a fat cell for energy, which is what most people want, they want to break down fat and get rid of it. You end up with the two main byproducts, which is going to be the energy production, which goes into our Krebs cycle or ATP. So then the end product of that is carbon dioxide. So you exhale carbon. That's that carbon backbone that fat is made up of. You break the backbone, and the end product after metabolization is carbon dioxide. So you're exhaling. The other end product is water. It's metabolic water. So the more body fat you are breaking down, especially if it's really like efficient, you're making more metabolic water. So that has to be urinated out, or you'll sweat it out, or some of it will come out in your stool, some of it will come out in the menstrual cycle. But those are your two byproducts. So if you're actually breaking down a lot of fat, regardless if you're drinking a lot of fluids, you're going to be urinating more, which I jokingly say to my clients, well, every time you run to the bathroom, you're burning more calories, you get more steps in. So it's all kind of, look at the silver lining there. Then there is of course some people that will drink a lot of water. Like, it is important to drink water, but some people, when they drink water, it goes in one way and out the other. It's just constantly going through them, or so they feel. That could be an element that they're not retaining the water, they're not hydrating properly. So in that case, I recommend electrolytes or sea salt and lemon juice, something to stimulate the hydration of the cells and keep it in. You might need a little bit of extra sugar in your diet to help the kidneys as well there. This is common when people go, like, especially low starch, so not just carbs, which can be all different kind of types of foods, but when they go low starch, you can see them going to the bathroom a lot more, and we'll just bring in sometimes a little bit more sugar, maybe a couple of dates or some sweet potato or something to stimulate the body to hold on to the fluids. Then there's another category, apart from the anatomical and the physiological aspects and maybe antibiotics, maybe infection, all that others. There is another category that's connected to the stress response as well. And this is more, we see this more in nocturnal urination, where people are getting up multiple times throughout the night to pee. So it's normal to get up at least once a night and use the bathroom. It's totally normal. As long as you fall back asleep easily, we don't have a problem. That's normal. 2 times, we're kind of like, okay, well, maybe we shouldn't have so many fluids before bed. But when it starts to get into I'm urinating 3, 4, 5 times a night, now we got a problem there. And what's causing this? It's usually connected to the adrenals and the stress response. When somebody is in a chronic state of stress, like all day, every day throughout their life, part of the stress response is to keep you alive, and your body will hold on to fluid during the stress response. And then when you go asleep, and ideally it would be a good relaxing sleep, when you go asleep, that counteracts the cortisol or the stress response. So that stress response gets turned off, and your body goes, oh, I can relax now, and it just lets go of the fluid, so that stress response is off, and your body's like, okay, we don't need to hold on to this fluid anymore, we can let go. And this is, you could connect this to float weight, why people might be one weight one morning and then overnight they'll see they lose 2 pounds or something. Like, that can be float weight, but it very much can be stress connected. And you'll see this a lot in people with chronic stress, what might be considered adrenal dysfunction or adrenal fatigue. That can cause someone to have this chronic urination throughout the night. That's usually it. They don't tend to urinate so much during the day, though. They tend to be more puffy and holding on to fluid during the day, and it's nighttime where that gets let go of. So in the dietary aspect, what I mentioned is like, That's usually why people are urinating more. And especially if they're bringing in like more herbal teas, smoothies, soups, if they're doing juices, more protein shakes, like the base of all these is going to be water. Like your body will hold on to some of it, but it is going to want to get a lot out. And it's not necessarily a bad thing, because when you start some sort of health or detox or cleanse protocol or whatever it is, like the idea is to really flush your body. Whatever you're breaking down, want to get it out. So urination is a huge part of that, and we see a lot of metabolites come out in the urine. That's why the Dutch test or the organic acids tests are so popular, because we actually do lose or excrete a lot of metabolites and toxins and whatnot in our urine, and then our sweat and our stool, and your menses as well. It's not, I know it's annoying, it can be a pain, but understanding, I think, can make the journey easier for people. You could at least say, well, if I'm urinating this much, I must be breaking down a lot of body fat and it's all coming out. So hopefully this is helpful. I just want to help everyone understand a bit more. And a couple of things you can do, like I said, lemon and sea salt water a couple of times throughout the day. Electrolytes, maybe a bit of starch or sugar in there. I like dates because dates are also high in potassium, so they'll help with the sodium potassium pump as well. So I hope this was helpful, everyone. Okay, have a great day, and as always, if you got any questions, pop them in the comments and I'll respond as soon as I see them. Bye bye.